A 2-week infant comes in with cough and sputum. Temperature is 102 and patient is developing normally, and the mother states that the patient was born without medical issues. What is the cause of this patient's presentation? So is it A, group B streptococcus, B, streptococcus pneumoniae, C, Haemophilus influenza, and D, Mycoplasma pneumoniae? So I'll let you answer the question and then I'll explain in 5 seconds. Okay, so the answer is going to be A, group B streptococcus. So for this one, we have group B. So anytime they try to mask an answer, so essentially this one's stands for group, so it's group B, but it's Streptococcus galactiae, and you can remember this by B for baby. But anytime when they try to mask an answer by not giving the name, you should look at it a little bit more, is it typically tends to be the answer, because they're trying to avoid giving you the actual one to prevent you from triggering that memory. So by hiding it this way, it makes you work a little bit harder. So that's just a little trick that I've seen them do. So for this one, this patient has pneumonia, and so the most common cause of pneumonia in infants less than 4 weeks is going to be group B strep. It can also be E. coli, but that was an answer in this choice, in this question. And so for the other ones, we have strep pneumonia. So strep is the most common cause of pneumonia in basically every other age group except for infants less than 4 weeks. So this is like the one exception. And then if you have a question where the answer is Haemophilus influenza, in this case, it's going to be typically a patient that's unvaccinated. They might give you history that the parents are people that don't want to vaccinate their child, or maybe they had an allergic reaction to vaccinations, or they're a immigrant from a country that doesn't have a robust healthcare system. And so the final one is going to be Mycoplasma pneumonia. And so this is the most common cause in 20 to 40-year-olds. So this is like an atypical pneumonia. So these patients are actually a little bit healthier. They can walk around. And so it's kind of harder to see that these patients have pneumonia. But then when you do a chest x-ray, you can see that they clearly have pneumonia. All right, and so for this question, really it's just asking you if you know what the most common type of pneumonia is in patients under 4 weeks. And so since this is a 2-week infant, it's going to be group B strep. So I hope that helped, and thanks for watching.